Welcome to InfoSource, a presentation of Berkshire Healthcare Systems, a not-for-profit system of post-acute healthcare services, including long-term care, short-term rehabilitation, independent living, assisted living, memory care programs, and hospice services available to our neighbors and families here in the Berkshires and beyond. I'm your host, Rachel Colasino, and my guests for today's show are Jessica Girardi, manager of the Rehabilitation Department at Fairview Commons Nursing and Rehabilitation Center, and Kara Holcomb, admissions coordinator at Fairview Commons. Welcome to you both.
Thank you.
Thank you.
Thank you for being here. So our topic for today is a focus on short-term rehabilitation services and how short-term rehab has changed over the past few years. So Kara, I'd like to start with you and just find out a little bit of information about Fairview Commons. Where is Fairview Commons and what is your history?
Fairview Commons is located at 151 Christian Hill Road in Great Barrington. Our doors opened as Willowwood of Great Barrington on May 11th, 1976. And we became part of the Berkshire healthcare family in 1999.
Okay.
And we offer two different services, long-term care, and what we're going to talk about today, short-term rehabilitation.
Great, thank you. So Jess, we've just heard Kara describe long-term care and short-term rehabilitation. How is short-term rehab different from long-term care?
Well, long-term care is more of a focus on those residents who may suffer from a chronic illness or disability, or just those patients who can no longer care for themselves safely at home, whereas short-term rehab is those patients who may need our services while recovering from a surgery or a fall or any kind of decline in function in order to get themselves back to the level of care they need to be at in order to function safely at home.
Okay. And I've heard you talk before about how it's so important for when patients and residents come in that you look at their goals and then you look at the plan to, like you said, return them safely home. Can you talk a little bit about that goal setting process?
Well, our rehab team consists of physical and occupational and speech therapists. So on evaluation, shortly after admission, we will come down and see you. You'll be evaluated by all three disciplines, and we'll discuss with you what happened to get you to where you are, what a normal day is for you at home. So from there, we can determine what services you'll need, what's your frequency and duration of therapy you'll be on, and there's a few factors that go into that, like how what your diagnosis is, how much rehab you can tolerate. So there's a lot of factors that go into it.
Okay. And what is the difference between physical therapy, occupational therapy, and speech therapy?
Physical therapy generally can work on your lower extremity strength and range of motion, your endurance, your ambulation and balance. Occupational therapy can focus on your upper extremities, your activities of daily living, and your self-care management, your bathing and your dressing and self-feeding and those types of things, whereas speech can focus on any swallowing concerns that you might have, any problem-solving issues, or just any cognitive deficits that may have happened in the event that brought you to us.
And it sounds like each patient has an individualized plan of care. Can you talk a little bit about that?
Over evaluation, when we meet with you, we determine what your needs are, what your needs and your wants are to return home. So we individualize each plan of care based on what those needs of that resident are.
Okay. And how has short-term rehab changed over the past few years?
Over the past few years, we're seeing patients that are having shorter hospital stays. So patients are coming to us more acutely. So those patients who are more medically complex, we need to adjust our rehab focus while with the still recognizing what your goals are and working towards achieving those goals with you. However, the recovery may be a little slower since you're coming to us more acutely, so you may end up with us for a little bit longer than normal would have been a few years ago, in order to safely get you to the level you need to be at to function at home.
Okay. And Kara, how is short-term rehab paid for?
Well, the majority of our patients come to us using their MediCare benefit, and that's achieved by the patient receiving a 3-night qualifying stay in their hospital. Others come to us using their primary care insurance, which, for example, could be BlueCross BlueShields, Health New England, United Healthcare. We also have a VA contract, and we also do we are partners with our hospice, community hospice agency, so we do work with them as well.
Okay. And Jess, what are the advantages of going, say, to short-term rehab following something like a knee replacement versus going straight home?
Well, initially what to recognize is the nursing component of it, that you have around-the-clock nursing support. So that new medication that the doctor put you on, you might have a reaction to that you wouldn't think of or even recognize that you're having a reaction to if you didn't have a nurse being able to support that. But in terms of the therapy aspect, you're in a short-term rehab, you're going to receive more aggressive therapy than if you were just to go straight home with home health. We can work with you to identify what barriers or limitations you now have and help work through those in order to make your transition to home safe. You might not recognize just the little things that you could struggle with at home until you're at home and you're kind of stuck, like maybe you can't get down to pick up the dog's bowl to feed them, or you can't get something out of the refrigerator to make yourself a sandwich, or even just issues you might have just simply giving yourself a shower. You don't recognize those things because you think to yourself, it's never been a problem before, so why would it be now? But we help you to identify those and work through those before you get home and you're kind of stuck.
So that ties back into what you were saying before, which is the short-term rehab really focuses on helping patients understand what they need to do to get back home safely and return to that prior level of function. Because like you said, it's the little things like feeding the dog or doing things that you may have taken for granted before.
Yep, you wouldn't think that you would have any problems.
Right.
We hear that all the time.
So what are some of the ways, I know the goal of short-term rehab is to return patients back home, so how do you help patients prepare for that and prepare for getting back home?
So the process, like I said, on evaluations, your therapist will discuss with you what's a normal day like at home. So if you wake up and you normally have to go out and feed the dog, we're going to simulate an activity that would be as close to that as we can provide in our facility. So, we're developing an individualized plan of care and create goals with you that you need to achieve prior to your discharge to make sure you understand those goals and are working towards them with us. Our focus is to get you to your highest level of function. So we'll review what your home setting is like. Do you have stairs? Is it 2 floors? Where's the bathroom located? And what you have available to you in terms of caregivers. Do you have someone that could help you get in and out of the shower, or is it something you need to be able to do on your own before going home? And one way we do that is we do offer home evaluations. We recommend that anybody that we have a concern with have a home evaluation where we actually go to your home with you and you can walk us through what a normal day is like for you, and from that we can identify any barriers or safety concerns and make recommendations that may make it easier for you to get around your house and help problem solve those issues before you actually go home and face them.
Great. And Kara, Fairview Commons has a rather unique area for short-term rehab, and can you tell us what makes it different?
Well, all of our rooms are beautifully decorated private rooms. Our short-term rehab unit is completely separate from our long-term care services that we provide. So patients are separated, which is important to a lot of people having elective surgeries. Some of the amenities that we include, we have free Wi-Fi, we have cable and TVs in every room, there's free phones, there's an internet cafe. So we have computer access. You can also bring your own iPads or laptops. All of your meals you order off a menu. So the menu is delivered to you on your breakfast tray, and you pick what you want for the day, and then the meals come to you. And we also have a private dining space. So if people do want to congregate for their meals with other short-term rehab patients, we're able to offer that, as well as the dining space is available for family functions. If there's a birthday or a party or a meeting that you want to have, you're more than welcome to use our space for that.
And I understand you had a patient who was using that space for a card group? Yes, that's great.
Yep, absolutely.
So Jess, it sounds like, from what Kara's describing and from what you've described so far, that Fairview Commons is creative in helping patients with their short-term rehab. So can you give us some maybe specific examples of creative things that you've been able to do to help patients prepare to return home?
Yeah, like I've said, we're very patient-centered focus, and we want to create individualized plan of care. So we want to simulate activities that you're going to do at home as best we can here. So we've had patients bring in their pets. If you've never used a walker before and now you're going to be getting around with a walker for a while, it might be totally different having a 20-pound dog running between your legs while you're doing it. So we've had them bring in their pets, had them move about throughout their room with their pet running around, just to make sure that they feel comfortable. We've had patients, actually we've taken them to the supermarket to make sure that they can identify ingredients to make a meal, and then actually do the money management part, is paying for everything. We have 2 gyms in our facility. So one of those gyms has a full kitchen in it. So we utilize that for patients to actually do some light meal prep, or if they really enjoy cooking, actually cooking a meal, doing their laundry. Being able to take clothes out of the dryer on the bottom is difficult for a lot of patients after a decline in function. So we try to functionally actually have them do the activities that they're going to do at home. We'll hang a wire across the gym and have them hang up their laundry. We even utilize the outside of our building. If we had a patient who was a farmer and he wanted to get back to the field and do what he needed to do, so we had him hiking up and down the hills and across the grass to simulate different surfaces to make sure that he would be safe in that transition home.
And like we've heard you say before, it's the little things that maybe you may not realize. So I've heard you say that you ask your patients to help you understand what they do on a daily basis. So walk me through your day. What happens when you wake up? And we want to help you do all of those things. Great. So Jess, what's new in therapy treatment for things like stroke or double knee replacement?
I think our rehab department is very active in continuing education. It's a focus, so we're always up to date with new utilization of new techniques that we have, and we have some great equipment in our facility to aid in that process of getting you back to where you want to be. We have some electrical stimulation units which can help increase your strength and nerve regrowth. We have diathermy and ultrasound machines that they can help you with, decreased pain or edema, and they can aid in the healing process of maybe you have a big hematoma or even wound care. We also have a vital stim unit. We have both our speech therapists are actually vital stim certified, so that's a unit that can help increase the facial muscles, and help increase the swallowing function. So we might be able to upgrade your diet, and get you back to eating regular foods if that was an issue that you have. We have a great OmniCycle, which is a bike that can give you a biofeedback for leg strengthening, which is a really great tool. But most importantly, we have a new fun piece of equipment. It's called the LECO lift, and basically it's a mechanical lift that we can utilize with patients who maybe haven't stood for a while or had weight-bearing restrictions, and they have that fear of falling. So this is a lift that actually will support your weight, and it gives patients the confidence and security to actually take that first step. but also it's taking the strain off the therapists from supporting you, the machine supporting you, so they can be more hands-on and focused with you and doing this functional activity rather than worrying about, making sure that you're supported. So it's a great new tool that we can utilize.
So if the patient were to lose their balance, they wouldn't fall?
They wouldn't
That's
go
great.
anywhere.
That's great. So Kara, I just want to switch over to you, and I want to talk a little bit about logistics. So what happens if a person comes in for short-term rehab and maybe eventually finds out that they need more care? What does that look like?
Well, that does happen occasionally, and when the patient comes in, they're evaluated by all of our therapy disciplines: physical therapy, occupational therapy, and speech, and we work hard to get them to their highest level of function. But sometimes it's not as, what we're able to get them at is not where they had been previously living at their own home. So the team gets together, obviously the patient is part of that, with the nursing staff, the rehab staff, social work, and with input from their physician, and they decide together and the family as well, what the best discharge plan would be for this particular patient. These could include senior housing alternatives, they could include assisted living, but they also could include long-term care, skilled nursing.
Okay. So we're going to take a quick break to learn a little bit more about Fairview Commons, and we'll be right back.
Nestled amidst the wooded and serene town of Great Barrington, Fairview Commons Skilled Nursing Center is minutes from downtown, in the heart of the beautiful and culturally rich Berkshire County in western Massachusetts. Fairview Commons offers you the best of both worlds. It's a locally run facility, staffed by dedicated healthcare professionals from the central Berkshire area. And it's backed by the expertise and resources of Berkshire Healthcare, the largest nonprofit long-term care provider in the area. Berkshire Healthcare is committed to fulfilling the health and residential needs of the people in the communities we serve. Fairview Commons is a proud recipient of the American Healthcare Association's National Quality Award. The Quality Awards recognize members' commitment to performance excellence by continuously demonstrating ever-improving value to residents and other customers. The Bronze, Silver, and Gold Awards recognize overall organizational effectiveness and capabilities and champion organizational and personal learning. At Fairview Commons, we pride ourselves on our deep commitment to our community. We offer a broad range of nursing home services, including short-term rehabilitation, skilled nursing, long-term care, hospice care, adult day services, and respite care. Fairview Commons offers a state-of-the-art, amenity-rich short-term rehabilitation suite for those primarily recuperating from orthopedic or cardiac surgeries. We proudly offer an elegant, home-like setting that allows our residents the comforts they expect while providing the care they need, including fine dining in our graciously appointed dining room, beautiful outdoor space, ample activities, and private family space. At the heart of it all is a focus on the body, mind, and spirit. Our rehab services include physical, occupational, and speech therapy. Our licensed therapy professionals help restore and maintain the body by focusing on helping our residents improve strength and mobility in order to participate in the activities they most enjoy. These services are provided up to 7 days a week when ordered by a physician. Fairview is more than a place to live. It's a place to enjoy each day to the fullest. Our activities program focuses on the mind and spirit of our residents by offering engaging leisure and recreational activities, arts and crafts, music, discussion groups, exercise sessions, religious services, and cultural community outings and more. Each resident at Fairview Commons receives the highest quality care delivered by our dedicated staff members working as a team. From the nursing staff to our front office personnel, everyone is enthusiastic about the role he or she plays in the lives of the people who entrust us with their care. Our staff is committed to providing compassionate care, using teamwork as their guiding principle. We're dedicated to treating each person with dignity, recognizing their individual needs, goals, and preferences. We create a care plan for each person, focused on helping them achieve the highest level of independence and quality of life. At Fairview Commons, we're perfecting the art of superior care. If you or a loved one needs short-term rehab, extra care after a hospital stay, or a nursing-supervised full-time living arrangement, we invite you to tour and meet our staff. See firsthand how we enhance the lives of those we serve. To make arrangements or get more information, call 413-528-4560. We look forward to meeting you.
Welcome back. I'm here with David Blanchard, who's the Director of Dining Services at Fairview Commons. And we spent the first part of our show talking about short-term rehabilitation and how it's evolved over the past few years. And part of this evolution is a focus on amenities like dining. So I was hoping to talk to you about that today, David. And we know how important food is. Food is important to everyone. And so much of our lives centers around the dining experience and around kitchens. So along with that, we always hear about institutional bland food, which I understand Fairview Commons does not have at all. So can you let me know what your perspective is on dining and how, especially for patients who might only be with you for a short amount of time?
Absolutely. Food is definitely a huge part in everyone's lives, and it centers around everything we do. It's fuel for our body. So the last thing that we want to worry about when someone comes into our facility to heal or get better is to have them worry about what they're going to eat. So therefore, we have this whole myth about all skilled nursing facilities or hospitals or schools have food that is institutionalized. And for years, that's true. We went from having canned foods, and we went from having chefs to having can openers, if you will. So a few years back, we looked at this and we said we need to steer our facility back in a direction where we're providing quality food service. So we revamped our whole department. We brought those chefs back in, and we started preparing some pretty neat stuff. And we're hopeful that when people come into our environment, that they see that our food is a quality food service versus an institutional type food. We still hear a lot of comments like, this isn't bad for institutional food, and I try to steer them away when I'm meeting with these people. I say, no, we're trying to lose that and get away from that. And they start to agree with me on that perspective. So with that, we created a menu. Our menu, we went more to scratch cooking versus canned foods. We went to more fresh produce. And if we couldn't get fresh, we went to the next best thing, which would be our frozen food. We use very little canned products. And the overall quality of our food has significantly improved over the past few years. Our menu is designed to provide a snapshot of the day. We have breakfast, lunch, and dinner menu all in one menu. So the patient can look at that and make choices throughout the day as to what they may want. On that menu, you'll see that we have a variety of things to offer at each meal. Eggs to order, for instance, at breakfast time, a variety of different cereals, yogurt, fresh fruit, whatever the fare may be that somebody's interested in. We have lunch and dinner, 5 to 6 entrees to choose from, 2 to 3, sometimes 4 starches, grains to choose from, 2 to 3 fresh vegetables to choose from, homemade soups, variety of breads and beverages to choose from, and plus, of course, desserts. So it's a pretty complete, comprehensive menu that provides a lot of variety.
And what accommodations do you make for personal preferences or for allergies, like gluten-free or vegetarian?
Everybody has preferences. You, me, we all have them. And of course we accommodate for any of those things. Gluten-free, dairy-free, any kind of intolerance that someone may have, we will plan their meals for them if they're not already planned. And even personal things. If, for instance, you have a certain tea you drink every morning, or a certain type of oatmeal you eat, or a beverage, or whatever, we'll get that for you. It's not something we want. We want you to feel like you're at home when you're with us. We want you to be in a space where you don't have to worry about food.
And diet plays such a big part of healing from so many diseases like diabetes or congestive heart failure. And how do you accommodate and especially educate for that?
When it comes to our diets, we have therapeutic diets that are offered at our facility. We take our menu and we break it down so it matches what your particular needs may be for your medical condition. So if it's a lower in sodium diet, we will have a menu specifically for that, or if it's consistent in carbohydrates, if you're trying to balance your blood sugars, or if it's lower in fat. We'll take that menu and we'll tailor it to you, and you can choose from those menus the foods that you would normally choose at home, or if it's a learning process, you'll start seeing on those menus the types of foods you should be choosing at home, or you could start thinking about choosing at home. So it's kind of a teaching tool in itself. I am the registered dietitian at the facility, so I do accompany with education on these menus and materials that people would need to start the process of teaching them what they need to know when they do go home. And a lot of people will start this process, but they'll also continue that when they get back into the community.
Great, great. Well, thank you very much for being here, David. And this has been InfoSource, a presentation of Berkshire Healthcare Systems.